This is Dan of Vagabond Awake, and today we have the good fortune of having Joan Denny visiting on the channel. She's living in Mexico now, and I talk about medical tourism as something that I would do if something serious, if my health was serious. I would go find the best doctor in the world for that treatment that had a good price and a really good rating. And I mentioned that in one of my videos, and Joan responded and said that she's actually had medical care outside the U.S., both medical and dental, and she enjoyed it so much that she ended up joining a company that helps people find medical tourist doctors. And so I invited her on the channel, and she's agreed to be on the channel here today. Welcome to the channel, Joan.
Thank you. It's great to be here.
Well, thank you so much.
Excited.
Well, good. Me too. This is important information for my friends and audience because medical expenses are becoming so expensive in the U.S. and other parts of the world, and because there are other parts of the world that have high quality medical care and for much lower pricing, and so it's a very relevant and important topic. So just a couple things before we get into the medical tourism, just to give people an idea of your background. Where are you from, Joan, and what kind of work were you doing before you left your home country?
Yeah, so I was born and raised in Indianapolis, Indiana, and then I spent most of my time in Arizona. I live in a few other states, but mostly in Arizona, and that's where I've got medical training. So I have 3 degrees. I have 26 years experience in healthcare. So I did about 20 years as a nurse working in surgery and recovery in the United States. And then I went back and got a double master's, so a master's in nursing and a master's of family nurse practitioner. And then I did that for about 6 years before we took off and got out of the United States.
Wow, that's a lot of education.
Yeah.
Quite a bit of dedication on your part. I have to congratulate you on that. It's good for you. So Arizona. And so how long have you been living outside the U.S. and where are you living now?
We've been outside the U.S. just like 14 months. So we we took off last June and we went to Portugal and Croatia. We're there for about 6 months, checking out that area. And this was obviously right when COVID was going on. So that really curtailed our big plans. We had planned on going further and then eventually Southeast Asia, but that didn't happen. So we came back to Mexico, then we went to Panama, and now we're back in Mexico.
You're back in Mexico now. What part of Mexico are you in?
We're in Guadalajara.
Okay.
So this is our 3rd time to Guadalajara.
Okay, great. I've been there myself. It's a beautiful town. So good for you. So you mentioned in the email that you've actually had some medical tourism and some dental outside the U.S. What has that been? How's that gone for you?
That was great. I did it in 2020. So in November and December of 2020, I decided to check out the medical tourism in Mexico and had a couple procedures done. And then in 2021, I had some dental work done. But I was so happy with it. I did 1 procedure and then decided to do 2 more because it was excellent care. It was actually better care than I expected. So I was pleasantly surprised with the quality and the price. Wow,
that's saying a lot. Because of your profession and that you worked as a nurse for so many years, that's not to be taken lightly. Both the price and the quality you were happy with. So as a medical professional, how do you think the services compared to, say, what you would have got in the U.S. In terms of professionalism and standards of practice?
Right. I actually was very pleasantly surprised. It was better. I was hoping that I would get as good care, but I wasn't expecting to get better care, better quality care, and get a much better price. So, this was private hospitals. I had a private room, very well staffed, English-speaking doctors, state-of-the-art equipment. It was, very impressive to me.
Wow, that's saying a lot. And so what would you say, was it 10% cheaper, 20%? How would you?
No, it was a good 50 to 60% cheaper.
Wow, that's amazing.
Yeah, I had 3 procedures done in that period of time, and this was just the surgeries that I had, and that would have cost around $20,000 in the U.S., and I spent $10,000, and that was with private hospital stay on 2 different occasions. That would never happen in the United States.
Okay, and so that was for both of them, about 10,000.
10,000 total.
Okay. Great, and then you had some dental work too, you mentioned.
Right, and that was in 2021. That was more just, cleaning, checkup, head to filling, that sort of thing. But again, probably a good 40 to 50% savings, I would say. And just, amazing care, the equipment, the professionalism, just, very surprising that it was that good.
And how would you say maybe one of the things I've noticed when I've gotten treated, when I've been overseas at various hospitals around the world, is that the bedside manner seems to be a little better. Like it's almost like the customer service is the doctors have more time to talk to you and explain things, and actually maybe listen a little more to your questions and that kind of thing. Was that your experience also?
Very much so. They take their time, excellent bedside manner. You don't feel rushed. You feel well cared for, well looked after. It's very refreshing. And again, as a medical professional, I understand the other side of it. Like I understand, you're busy, you have a schedule. Unfortunately, in the United States, you're usually overscheduled. They will double book you. That's what would happen with me. So you're just really tight on time, and you just don't have that same feeling that you're so rushed. Like you can plenty of time to talk and get your questions answered, and it just makes you feel there's just a level of trust and security there. I think that's real important. Yeah,
and you make a good point. It's not a negative intent by the medical profession in the U.S. It's just that they're just, as you said, they're so overbooked that they're trying to run from one room to the next. So that's just the state of affairs in the U.S. So, do I understand correctly that since then you began to help people find doctors and dentists in Latin America who are qualified to perform various medical and dental services that they may need? You've gone into the business, is that right?
Yeah, and that was kind of by accident. I just had a really good experience, and one of the owners approached me and just said, with your background and you had a good experience, would you be interested in doing this kind of work? And I'm like, well, as long as I can, do something online, because we want to continue to travel, and we have work that we also do as well. And they're just extremely receptive. So I started working with them. It's Pulse Protocol is the name of the medical tourism company. They're out of Los Angeles, or they're out of Venice Beach, California. It's US based, but there's 130 doctors on the platform, and they have a combined experience. Pulse Protocol has about 50 years of experience, and they've facilitated 10,000 medical tourism procedures. So it's pretty impressive. So when I kind of knew all that, I thought, why don't I? Because it's my love of surgery never really went away, and I like helping people. And it's scary if you're having surgery. There's that anxiety there, and I can kind of walk people through that whole process from start to finish and get them a good price. So I'm kind of, I can be a good advocate for patients and a consultant. And then they're mainly in Latin America, but they are looking to expand. They're in negotiations right now for Southeast Asia and for Europe. So for more providers are hopefully coming on board. So that's exciting.
Wow, that is exciting. Well, that's amazing. And so, yeah, I would think that, especially since you've actually had work done outside the U.S., it's a more believable situation. You've done it yourself, so it's not just someone on the phone making a living.
Right. I've been the patient and I've been the professional. So I've actually now I'm up to 4 procedures. I've had 4 things. So, but I've had good. it's been a good experience. And I've one doctor in particular, he's like a brother. He's just awesome. And I like him a lot. So
That's great. That's great.
yeah.
And so, what types of medical and dental services are you able to find for people in Latin America, and how do the prices compare to the U.S.?
The platform has all kinds of doctors. So we do vascular procedures, orthopedic procedures, so total joint replacements, spinal procedures, general procedures, so general surgery, stem cell. We're doing some work with some great clinics that are offering for degenerative disorders like autism and dementia. So we're working with those kinds of patients. Weight loss, so bariatric procedures, gastric bypass, gastric sleeve, plastics and cosmetics. So just a lot of different, and then dental, so dental implants, dental work. And I would say the savings in general is about 40 to 60%.
Okay, great. So yeah, I mean that makes sense. If these are doctors and you're learning about their specialties, you're pretty much anything people need. I would think you're eventually going to have people or doctors that are online that take care of people like that. Would you say?
Right.
Okay.
Yeah, they're definitely looking to expand their services. So mostly Latin America, but and then other specialties as well. So it's an exciting time because it's a good service, and people are starting to get back to travel. Even with COVID, you know, of course they're taking all the precautions, but they're moving forward in a lot of areas with treatment. So that's good.
Right. So are the buyers of these services usually able to get reimbursed from their U.S. insurance companies, or are these more for uninsured people that just want to pay for services themselves and save money by opting for medical tourism?
Right.
Would you say?
That's a good question. I would say mostly it's out of pocket, and they're getting a good value and better price with the medical tourism. Some of the dental procedures they're able to get reimbursement for if they have dental insurance, and then some patients that work for large corporations, they're able to get some reimbursement for the medical procedures. But in general, I'd say they're paying out of pocket for these. For example, we work with a lot of Canadian patients, so even though Canada is a socialist system, the wait times are incredibly long.
Right.
So if someone, for example, needs a total hip replacement or total knee replacement, they're put on about a 2-year waiting list right now. And if you have that kind of pain, if you're in pain every day walking, you don't always want to wait that long because that's a quality of life issue. And we can usually get those patients treated in a few weeks.
Wow, that's a big difference, especially with that kind of savings. It would be tempting rather than just hauling your body around when you're in pain. So that's good to know. So what are some of the examples of medical tourism services that people have been able to locate through you, and how did the prices compare to what they would have paid had they had the work done in the U.S.? You kind of already answered this question, but maybe give...
Yeah, like the cosmetics procedures are very popular, so we do a lot of that. So for example, we were promoting a mommy makeover, and what that is that's for women that, you know, have had babies, they're done with having babies, maybe they're breastfeeding and they've gained weight and all that sort of thing. So it's essentially 3 procedures. It's a breast augmentation, tummy tuck, and liposuction. And that's about, again, a 50% savings from what it would be in the US, and that's around $8,500 is what they're charging for that. And that's like a 6-7 hour procedure. So it's life-changing when people get those types of operations.
Oh, yeah.
What I'm really excited about is we're working with a weight loss doctor. So he's like world renowned he's one of the top in Mexico. So I'm really excited to get patients in for treatment with him. He's got a team of people that he's worked with for about 15 years, and this is in Guadalajara also. And it's an excellent team, and they've just done, it's life-changing what they can do for people. So that's awesome. And then the other thing I'm excited about is the stem cell clinic that we're working for. So there's 4 clinics I think 2 of them are open now. One is in Nuevo Laredo, so just outside of Laredo, Texas.
Right.
That's kind of near Monterey. That's sort of that area of Mexico. And that clinic helps with degenerative disorders, so autism, dementia, that type of thing. They do other treatments as well, but they helped a family, and the family was so moved. One of the family members had pretty bad autism, one of their children, and they had such good results that that family set up an endowment for the clinic to help pay for the cost for other autistic children to have treatment. So whether they're coming in for Canada or America, they're going to help with that cost.
Wow.
And then the clinic itself, anytime they treat a patient with autism, they treat 1 Mexican child for free.
Oh, that's great.
It's really great.
That's wonderful.
It's pretty cool. And that the endowment is time sensitive, though. I think it's ending the end of December. So if people are interested, I encourage people to check them out. It's an excellent organization. It makes me almost cry. That's life-altering things happening, and the fact that you're even saving money with it, that's brilliant. Joan, thanks so much for coming on the channel and sharing information about this important topic. Some people just don't have the money, and if they can save 50 or 60% and get something done, and they suddenly have enough money for that, then it could be life-altering. Right.
So thanks for coming on and sharing this information. And also, I think just as important, or maybe more important, is that this idea that the confidence, I think, from your going through it yourself. Because
right.
people, they think of foreign countries as maybe not being as good as America or something. And
right.
many of the studies around, America doesn't even rank in the top 10 anymore. So, but I think the average person in America doesn't really know that. They just sort of think America is the best at medical or whatever. And
right.
And that's not necessarily true anymore. And I think it's the fact that it costs more, I think, is makes it even more difficult, especially if somebody's uninsured, and if they have a nice resource of someone they can go to and ask questions. I think it's really great what you're doing, and I want to thank you for coming on the channel and sharing this information. And so if someone wants to get in contact with you, should I put a link below, or what should I do so people can contact you? Yes, so it's our website is ripplesandripples.com, and that will take you to a landing page where then you can get more information on the medical tourism and kind of go from there. Okay, great. I'll put that link below, and I'll also add it to the screen here so people can see it. Okay. So thanks so much for coming on the channel. It's really appreciated. Thanks so much for sending the email. It's an important topic, and it's one I wanted to address. So I'm very glad you took the time to come share this with us. Well, thanks for having me. I really appreciate it. And again, I'm just a big admirer of you. So you're a role model to me. Well, thank you so much. Well, you have a wonderful day. Take care. Okay. Thanks, Dan. Bye-bye. Hey, if you liked our video, please like, comment, or subscribe. Any of that would help our business. Thanks so much.
Thank you so much.
Click the link in the notes below this video to get a copy of this content. Plus, grab a free copy of my ebook, How I Fired My Boss and Traveled the World for 13 Years. While you're there, check out our catalog of retired cheap reports all over the world and our hobby income course that we just released. Thanks so much.